No. Good morning and welcome to the Public Health and Minority Health Disparities Subcommittee. Today is February the 11th. We have 3 bills on the agenda that we will be considering. 2 of which we're going to try and move. 1 we are going to have a discussion on, but as you all know, at this point in session, we have a lot of moving parts and they are continuing to move. So we will get as far as we can, and I will try and adjourn by 12:15 so that I can make sure that everybody has an opportunity to get some lunch. So we are going to start with House Bill 443. This is the baby food labeling statement regarding toxic heavy metal testing terminology. Erin, if you can walk us through the bill.
Okay, I think the best way to explain this bill is to give a little background. House Bill 97 of 2024 was Rudy's Law, and that bill prohibited a person from selling, distributing, or drafting for sale baby food that contains toxic heavy metals that exceed the limits that are established by the FDA. And as part of this bill, which this committee passed last year unanimously, it required that when a baby food is tested for a toxic heavy metal that's subject to an action level, regulatory limit, or tolerance established by the FDA, that the food had to include a specific product label. And the label, according to the bill, would have to read, "For information about toxic heavy metal testing on this product, scan the quick response," and in parentheses, QR code. So the only change that House Bill 443 makes, which is before you today, is a change to last year's bill regarding the required wording on that product label statement. So the wording would now read, "For information about toxic elements testing on this product, scan the QR code." And the reason for the bill is that California has a similar law, and this would mirror their labeling requirements so that manufacturers could have uniformity when complying with the laws.
Thank you, Erin. And as I recall from the bill hearing, this would allow manufacturers to be compliant with existing labeling. Is that correct? Because it would mirror the language from California.
Well, it would just make it easier for them so they could put the same label on the different products in the different states.
Thank you. Is there anyone who wants to be heard on this bill? Delegate Chisholm.
Thank you, Madam Chair. So,
Can I move the bill before we start discussion?
yeah.
Delegate Hill has moved the bill. Do I have a second?
Second.
All right, it's been moved and seconded. Delegate Chisholm.
So I understand we're using the same labeling now, but just expanding the products.
No, nothing's different, just the words in the label.
It's mirroring the language from the California law, so that and I see Sarah Price is nodding her head. Sarah, do you want to answer the delegate?
Sure. So the point of the bill is to reduce the patchwork issue, where I believe California's testing requirements are actually more expansive than Maryland's. This bill would not change anything about the testing requirements. Everything still needs to be tested. The information still needs to be available online. It's just adjusting the language on the label so that businesses don't have to make a California baby food and a Maryland baby food jar. So everything else remains the same.
Makes sense.
This is essentially a technical change, correct?
Yes.
Okay, thank you. Any further questions, concerns? Anyone want to be heard on this bill? All right, we have
the bill.
The bill's been moved and seconded. All in favor, say aye.
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 Anyone opposed, go ahead and raise your hand. All right, that bill passes unanimously. Thank you, everyone. We are now going to move to House Bill 468. This is the emergency petitions bill. This bill did pass unanimously from this committee last year. And it is, sorry, don't have my notes in front of me. Aaron, if you can talk us through the bill and the proposed amendment, I think you said Delegate Alston might be talking to us about the amendment.
Okay, as Delegate Bagnall said, this bill is identical to House Bill 1019, which passed HGO and Judiciary last year and also passed the House unanimously. The bill would clarify that an endorsed petition for emergency evaluation is effective for 5 days after endorsement, and it authorizes a court to extend the effective endorsed petition by 5 days at a time for up to 30 days based on the presenting behavior of the individual. An endorsed or extended petition must be served expeditiously, and the court must include on the petition the date the petition expires. The bill also states that a peace officer is authorized to use force in accordance with the Maryland Use of Force statute when executing the petition. Delegate Alston, were you wanting to present your proposed amendment today?
Yes, thank you. Good morning, everyone. So in reflecting on the bill, we just wanted to name the bill after the 2 officers who lost their lives in the line of duty serving one of these petitions. I'm waiting for confirmation from the family that they're okay with it. And if so, it would be the memorial act in honor of them. I will know tomorrow. The sheriff loved the idea. He said the families would love it. I just want to actually hear from them directly. And once I hear from them directly, then I'll disclose the names and give the amendment to Ms. Hopwood.
Thank you, Delegate Alston. Delegate Hill.
Yeah, so thank you. And thank you, Delegate Alston. I know we had conversation. I did not know about the amendment until it was sent out yesterday. So in the hearing, you presented the bill as being about, and I think the essence of the bill is about trying to make sure that officers, peace officers, sheriff's officers, whoever, if they have difficulty finding someone, that the families and everyone don't have to keep starting the process over again when the person who is of concern continues to have the same behavior. So you had 5 days, they absconded or we couldn't find them. Now we know where they are, but because it's run out 5 days, we've now got to start all over again. But I think, and no disrespect for the officers who died, when we rename it in their honor, it really suggests that this bill is about what the opposition said it was about, which was about giving law enforcement more authority or clearer authority to use force and actually encouraging them to use force. Because if it's about 5 days, 10 days, up to 30 days to serve a petition, can you explain to me what that has to do with the tragedy of these officers' death? Did they die because a petition could not be extended beyond 5 days? Because I don't see the nexus between why they died serving these petitions and why this bill.
Okay, so the bill has multiple parts. The first part is clarifying use of force. That is the purpose of the bill, is to clarify that these peace officers may use necessary and proportional force when they are serving an emergency protection, because there are times when they go to serve these petitions and the person who they are trying to serve is violent. They've had objects thrown at them. They've had weapons brandished upon them. They've had weapons used upon them. And when the law is not clear in that area, it presents problems. During our work group that our county has, there were other problems that were discovered, including the frequent repeated use of these petitions. And we have, as a result of that, implemented some things in our county to catch people who are abusing the system. But it's not just abuse. There are times when we have people who will abscond from one state to another to avoid being served. And so we looked at this holistically, and in looking at it holistically, giving the judiciary the ability to do an extension is also an important part, because sometimes the behaviors continue to present and the person could be absconding intentionally, they could be homeless, but they could still be a threat to themselves or others. And so by having the judiciary come up with a process to extend the petition, just like we do in protective orders for domestic violence, it saves the family members the trauma of having to go back and forth, but you still have to have the presenting behaviors. So however the judiciary decides they want to handle that process, they will regulate that as they're a separate but equal branch of government. I hope that answers your question.
It does. Thank you.
Mhm.
And if I could ask, I just consulted with counsel. We can move this amendment in concept pending confirmation from the families. So do I have a motion on the amendment?
Move the amendment.
Second.
Second.
All right, it's been moved and seconded. Is there any further discussion? All right, seeing none, all in favor, say aye.
Aye.
If anyone is opposed to the amendment, go ahead and raise your hand. Delegate Hill, we've got you as opposed on the amendment. Thank you. Is there a motion on the bill?
Motion to move the bill as amended.
Second.
Second.
All right, it's been moved and seconded. Is there any further discussion on the bill as amended? Seeing none, Delegate Martinez.
I just want to thank the bill sponsor for bringing the bill back. Thank you.
Thank you very much. All right, all in favor of the bill as amended, say aye.
Aye.
Anyone opposed, go ahead and raise your hand. All right, seeing none, thank you very much. House Bill 468 passes unanimously. So we have one more bill today. This is for discussion because we this is the House Bill 334, Universal Newborn Nurse Home Visiting Services Program, Establishment and Insurance Coverage. This bill, the Senate bill was amended into a work group and just passed second reader in the Senate, but we did receive and we have the amendments of that the Senate Finance Committee took, but then we received another request of amendments. So Aaron, if you can talk to us about the amendments from the Finance Committee, and we will take those up first.
So the reprint that was distributed reflect the amendments that Finance put on and that are on second reader, or just past second reader in the Senate. The amendments strike the bill as introduced and they create a work group on universal newborn nurse home visiting services. The work group consists of a member of the Senate, a member of the House, the Secretary of Health, and members appointed by the governor, which include a representative of the Maryland Hospital Association, one representative each from the Family Tree for Baltimore City, Family Connects Frederick, and Family Connects Prince George's, and two members representing private insurance carriers. The Department of Health would staff the work group, and the work group is required to compile updated patient data and expenditures per patient from the Family Connect programs that are currently operating in the state, compare other maternal and newborn health programs in the state and in other states to the Family Connect programs, and identify service gaps between the Family Connect programs and similar programs and potential funding sources to close the gaps. And the work group would report its findings to the General Assembly on or before December 31st, 2025.
Thank you.
Thank you, Aaron. So I know I have Delegate Kerr here. Did you want to speak on the bill and what you and your Senate partner are discussing?
Yes, thank you, Madam Chair. I just wanted to give the subcommittee an update on where we are. The bill as it passed second read in the Senate today takes out the provision for Maryland Department of Health to do the staffing, and the bill will be self-staffed. So we can eliminate that fiscal note. There's also an amendment that was presented to me this morning to add some additional members to the work group. And So that's something we'll be considering over the next week, as well as the implications of the change in staffing. And we should have all those answers for you in time for next week, so we can take some action on the bill. Thank you.
Thank you very much, Delegate Kerr. Delegate Hill.
Thank you. Delegate Kerr, I'm just curious. I know this thing had a high fiscal note. What I'm not clear about is whether turning it into a work group actually is necessary, rather than just not pass the bill and come back when we think we have the money to support it. And so the information we're gathering is going to potentially change it how?
The purpose of the work group is to look at possible funding sources and consider ways that the fiscal note can be brought down, perhaps not by using registered nurses, but by using LPNs or other healthcare professionals that are not quite as expensive as registered nurses, just to look at other possibilities about how we can be more economical. It may turn out that there is no way to make it more economical, but we'd like to have some time to at least consider those possibilities.
So if the work group is self-staffed, why can't you just do the work? Why do we have to pass a bill to look into those issues?
We don't necessarily need to pass a bill. It's just where we are right now in the life of this bill.
Okay, because I'm thinking back to when I had something before another committee, and that chair at that time said, just do your own work group, and we did it. And what you said we're looking at is to see what other funding sources are. That's not in the charge to the work group. So it's compiling data on expenditures, looking at the programs that already exist, and identifying service gaps. It doesn't say anything about looking at how those programs are funded and what alternative funding sources there are. So that's not
I
in
think
the amendment.
that's just part of looking at the other groups. So just giving you an update on where the bill is in the Senate, because they moved first.
Thank you.
Thank you. And Delegate Hill, in answer to your question on the second page of the reprint, under the work group shall, line 3, it does say identify service gaps between the Family Connect programs and similar programs and potential funding sources to close the gaps.
Got it. I did. Thank you. I did overlook that last part of that section. Thank you.
No, thank you. Thank you for the dialogue. It's important. Delegate Lopez.
Thank you, Madam Chair, and thank you, Delegate Kerr, for bringing this bill forward. I remember being really struck in the committee hearing about how this could really benefit my district, particularly if it was intentional about how to do outreach with immigrant communities. My district is it's about 39% foreign born. And so for me, there's a good foundation here, and the way to strengthen this is to make that part really intentional, because those, I think in my district and throughout a lot of the state are communities that need that type of support. And so from my understanding, Family Connects is more of a universalist kind of approach for things. And I also understand that the intention of the work group is from a more financial perspective as opposed to a programmatic perspective. But like, if you don't have the money, you don't have the program that you want. So I'm wondering, with the current set of amendments, do you feel confident that the direction that this work group is going into can support more immigrant communities?
Delegate Lopez, do you mind if I hand that question off to Pilar Olvio, who's the director of the Family Connects program in Frederick?
Thank you.
Thank you.
Hi, Delegate Lopez, thank you so much for the question. My name is Pilar Olivo, and I'm the Executive Project Manager for Family Connects Frederick County. I think intentional outreach to across communities is a very, very important part of the Family Connects approach, by being offered to everyone, hopefully before hospital discharge, families through there's a dedicated role that certainly can accommodate bilingual speakers to offer that visit to families directly. There is definitely the opportunity to customize that for additional outreach to communities. In Frederick County, there's a special role, actually across the model, there's a role called a community alignment specialist. That role creates warm relationships with trusted leaders across the community to make sure that families are not showing up at the hospital and learning about Family Connects for the first time, but that they've been hearing about it from people that they trust in their community as well. So I hope that answers your question.
And Delegate White Holland.
Yes, thank you, Madam Chair. And again, I'm so very excited about the outcomes that this work group will have. I wanted to know, because I know that we're honing in on Family Connects, but I'm aware that there are several other evidence-based home visiting programs and models that do exist. And so I didn't know if maybe the way that I interpret some of the provisions of the work group as far as in comparing other maternal and newborn health programs, will it also examine and compare and look at some of these other evidence-based programs? I recall learning about Nurse Family Partnership, and there are several others that do exist within the maternal and child health ecosystem, and I just didn't know if that is also being considered here as well.
Delegate White Holland, I think Pilar is probably best to answer that question as well.
Thank you so much for that question. Family Connects is a great complement to existing long-term home visiting programs, and also can be customized for local communities that may have a strong program for example, Nurse Family Partnership. There's no need to duplicate a service when there's already a nurse visiting, having a relationship with the home. And so Family Connects certainly can be customized so that those families are not being approached twice with, at the same time, there are the clinical component of Family Connects with a nurse visit is incredibly important and is a great, again, complement to programs like Healthy Families, and can be a kind of second, once families are home, often new risks emerge that might entail, a reconnection or a new consideration for a family with something like Healthy Families or parents as teachers. So that is certainly in Frederick County and also in the other sites that operate Healthy Families. We all regularly connect to long-term home visiting programs.
So, Madam Chair.
Go ahead. Go ahead.
If I may, so it seems to me that this is more of a complementary program that will add to what is already in existence that we already have in our state. There's, I think, about 14 MCHEV programs that are in existence. So it sounds like to me that Family Connects would be an opportunity to explore what further customization might be available in our various communities. Is that so?
Exactly. Customization and extending a nurse visit and this kind of support to catch postpartum risks, which we find are emerging at a higher rate than people might expect. So
yeah. Okay.
Thank you.
Thank you so much, Madam Chair.
Thank you very much. And this is the opportunity to ask those questions because we're going to have this week to get them answered. And I know Delegate Kerr is working closely with our Senate partners as well. Are there any other questions, concerns from the members? Delegate Hill. You're still on mute.
Yeah, I wanted to ask Ms. Olivia sort of a follow-up of the question I asked Delegate Kerr. The work that the work group is doing, is this work that does being an official work group give you any additional tools or gathering power? Would not you be able to get the same stakeholders around the table and compare data and do the things that the group's doing, or is there some additional, oomph that having it as an official work group gives?
Delegate Hill, it's kind of a
I
judgment
meant to
call.
ask her.
Oh, okay. I will then let
Pilar.
Pilar respond.
It seems to me that the opportunity to engage stakeholders through a formal work group does kind of leverage a kind of deeper conversation about how this model could complement existing services. And so I have to say that I think a work group does raise the visibility and the opportunity for Family Connects, what it can offer families across the state.
Thank you.
All right, and I see we have Jennifer Witten.
Thank you, Madam Chair. Jennifer Witten here from LifeBridge Health, and we work with the Family Tree. That's one of the sites in Baltimore City. Delegate Hill, just to respond to you, and Delegate Kerr, I think the other value here is that potentially there are some federal resources that we could consider to complement some of these programs. So without kind of going through this process, we really won't know that. So although MDH may not be staffing the committee, I think their engagement and leadership will be important. If you all recall, the chair had a visitor from New Jersey the day of the hearing who was instrumental in helping New Jersey tap into some of those federal resources. Now, I say that in the context of we're not sure where that's all going. So I think, we'll have to keep evolving with the policies that we see. But if there is opportunity for us to bring those resources to Maryland to complement these programs, I think we should take full advantage of it. I think this helps escalate that process.
Thank you very much. That does clarify it. So it sounds like what you're saying is having a more formalized process for the work group might give us greater access to some existing resources. Is that what I'm hearing?
Yes. Yes.
Thank you. Delegate White Holland.
Thank you so much, Madam Chair, and forgive me as I know that this is becoming a work group, so this may
That's
be
all right, because it's, as I said, it's still moving parts. So now's the time to raise the concerns before we vote.
Indeed. So
Cities
I think
to
it goes back to my earlier question around the fact that there are several other evidence-based programs. And I didn't know, and forgive me if this was elevated during the hearing, or even in the midst of this conversation, I may have missed it in some of the questions that were raised. But it would be helpful to understand as to the elevation of this particular model in comparison to some of the other, I think about my MCH course back in the day, right? Where we explored a lot of these various models that exist within the context of Title V. And so I didn't know if you could just expound upon why this particular model in comparison to some of the others that have been around as well. And I know that you all coordinate and communicate with each other, but I didn't know if there was a specific reason or there was a particular complement of services that are found here in comparison to some of the other evidence-based models that do exist.
Is that for Ms.
I guess whoever is best to answer.
And before you answer, I will also just note that part of the amendments, the work group shall, number 2 is compare other maternal and newborn health programs in the state and other states to the Family Connect programs. So the question is why are we comparing them to the Family Connect programs? Is that correct?
Yes, if that's fair to say. I know that I spoke to that a little bit earlier, but I just didn't know even from the beginning, the intent of the bill was to expand it further throughout the state. I didn't know if there was something very specific or that was, special about Family Connects in comparison to the others that do exist in our state.
Well, so I'll speak about the opportunity that Frederick County and I think other PG County and City of Baltimore may have other issues that they wanted to address. But I'll speak about the way that we selected Family Connects in Frederick County and the opportunity that we saw that other jurisdictions may also find compelling. So from our perspective, the opportunity to have an impact on reduction of child protective service investigations through a brief intervention that happened, within 12 weeks after baby arrived at home, and that lasted for up to 5 weeks. That was very compelling because we were interested in preventing adverse childhood experiences. The other opportunity that we saw is the nurse intervention enables a reduction in cost for infant overnight stays and emergency department utilization. We saw an opportunity as well to support maternal health in the postpartum period, especially given the percentage of maternal deaths due to pregnancy-related complications that occurs between hospital discharge and that 6-week postpartum appointment. So those were some of the kind of the mix of opportunities that we saw in the model. And the other models, while provide support to a very small group of people, and as a universal model being offered across a community, it really drives population health. In our experience in Frederick County, having visited about 2,600 families since we launched, 86% of those families have at least a risk, one maternal health factor or infant health factor, at least one risk. So requiring either education, a referral, or some kind of urgent, acute need solution. So we, even in a universal model, we do see widespread risk across our community, and this model has the opportunity to improve population health. So those were the opportunities that we saw in the model.
Okay, thank you.
Thanks.
Thank you. And Delegate White Holland, I know that this is an area of expertise for you as well. So I would encourage you during the next couple of days to get with the bill sponsor, because I know that he is still actively working the bill and open to ideas. Delegate Hill.
Thank you. And I know you want to, and I'm not trying to again, but I'm just listening to what Delegate White Holland is saying and wondering if Delegate Kerr would, as he's having these discussions with the Senate as the bill is moving, consider having a discussion with them about making the charge a little bit more general to say, Family Connects and other models, that address home visits by, qualified nurses or whatever, or qualified people in the first 12 weeks for the baby and the mother. And I also like the fact that it also addresses folks who birth stillborns, or even children who died early, who weren't stillborn but died early on. So I'm just suggesting for consideration that Delegate Kerr talk with the Senate about broadening that direction instead of specifying just one model.
The bill was never intended to promote one individual model, but to promote the concept and offer Family Connects as a possible model for those who do not have one in place. Delegate Hill, if you think that's something that's missing from the bill that would be beneficial going forward, yeah, I'm happy to talk to the Senate about that. Thank you.
Thank you very much, Delegate Hill and Delegate Kerr. And I'm sure that our colleagues would be happy to work to finesse that language because I think there is from this subcommittee, it appears there's broad scale support for the concept. We just need to get the language right. Is that an accurate assessment? All right, is there anyone else who wants to be heard on this bill before we adjourn? We're not going to vote today. Obviously, we're still working on the amended language. But I wanted to make sure that we had an opportunity to have the discussion, especially with the bill sponsor and with our stakeholders. All right, seeing none, do I have a motion to adjourn? I saw
So
Delegate
moved.
Hill raise her hand.
So moved.
To adjourn.
Second.
All right, it's been moved and seconded. Thank you very much. I will see you all at 1 o'clock for bill hearings. Please go.